Are there any questions for the audience for our AI and health folks? For you, a long day, but come on, AI and health. Perfect.
Lauren, real quick question. If you were to put a headline to your research, the overarching finding that matters the most, what would it be?
That's a good one.
Awesome green beans.
Restaurant food environments predict health outcomes more than food deserts.
Yeah. Well,
Yeah, don't eat in the Midwest or the South.
So what kind of intervention strategies would you motivate based on this data? Results, based on the results?
Right. So I would relate another data set that I study that uses that based on smartphone mobility data, so we can see where people are, which outlets people are going to. And together, you know, we'll see what outlets people are going to and then the nutrition of those outlets. Then that can inform, you know, for certain populations that we really want to target, populations at higher risk or experiencing, you know, greater disparities, health disparities. We see those, the outlets that they're going to and try to design interventions that would help improve the, help. So an example I always give is like, what are restaurants that are culturally accessible to people, but are still more nutrient dense? And a restaurant that always comes up at the top of my list that kind of hit those targets is El Pollo Loco. So much healthier menu than all the other fast food outlets, but it's similar price point. And so kind of thinking about how other restaurants could add menu items that could help adapt to that, and really being able to capture the people and the preferences of the people who we would most want to target.
We've got time for a couple more questions. In the back, okay.
Ready first. Oh.
Thanks. I had a question about sepsis, actually. I'm sorry, I forget your name, but I really liked your talk.
Karishma.
Karishma.
Yeah.
Thank you, Karishma. It seems fascinating to me because there probably are a lot of different timescales for how quickly sepsis can transpire. And I was wondering, like your predictors actually seem to work really well. So in general, is like, what is, I guess, kind of like the lag of like when you measure the patient's expression and like other features to like when they get sepsis, and does that matter at all?
Yeah, that definitely does matter. It is an extremely time-sensitive disease, and people come into the ICU, and some people get the sample taken right away, and then you can get another sample taken, you know, a day after, and between those days, your gene expression values could also change. The problem that we're facing in our study is that these 16 data sets are coming from different time points in the, like, they're all in the ICU, but they're all like, they could be different age groups. They could, you know, more elderly or pediatric. So we have a lot of like variables that we have to figure out how to work with and, you know, capture the heterogeneity, but also homogenize at the same time. So it's very tricky, but it is very time sensitive, and yeah, we're figuring out how to capture that better.
Nice.
One more, I think I see it.
One thing I worked at, did consulting work for the CDC for several years, and one thing that people don't generally know is that because of our constitution, the states cannot be required to report medical data to CDC. Plus the the Commonwealth, like Virginia and Pennsylvania, they report on a, but per city and per county. I think that what the work that you've done could be really valuable for national public health, because we really have these major gaps in understanding what's happening. So, for example, Katrina, they didn't report anything, and all the, some states are much less likely to report than others, I would say. And I think that you would be well to maybe make them available of the work you're doing.
Thank you. So this work is mostly based on public data. You're right in the sense, for example, RSV, only 13 states do any sort of reporting to at the national level. Yeah, and we're trying to start a conversation with state health department as well, saying like, look, we can do these great things if we have the right data. So if you can give us the data, if you can make your data public, then we can also solve these problems for you. So we're trying to create that conversation as well.
That would be very valuable.
Thank you.
Okay, I think in the interest of keeping on schedule, let's give this panel another round of applause.